Good morning, everyone. My name is Chu Yishen. I'm from Group 2.1. Today, my group and I are going to talk about the parameters on acute periodontal diseases. My group members include Abinaya, Anba, Abigail, Ang Yisheng, Carrie Stong, Chang Yiyuan, Cheng Xinghui, Chong Chi-wei, and also Chong Shu-yi. So, what are acute periodontal diseases? Acute periodontal diseases are actually a kind of clinical conditions of rapid onset that involve periodontiums or associated structures and may be characterized by pain or discomfort and infections. So they may be or may not be related to gingivitis or periodontitis, and they may be localized or generalized with possible systemic manifestations. So here are some clinical features of acute periodontal infections, which include gingival abscess, periodontal abscess, necrotizing periodontal diseases, herpetic gingival stomatitis, pericoronal abscess or pericoronitis, and combined periodontal endodontic lesions. Now, Ching, we're going to talk about the gingival abscess.
Hi, I'm Cheng, and now I'm going to talk about the first acute periodontal infection, which is the gingival abscess. So it is a localized purulent infection that involves the marginal gingiva and also interdental papilla. So how does a gingival abscess looks like? There will be localized swelling in the marginal gingiva, and it will be red, smooth, and also shiny. And the lesion may be painful, and a purulent exudate may be present. So the therapeutic goal is to eliminate the acute signs and symptoms as soon as possible. Treatment consideration will be drainage to relieve the acute symptoms and mitigation of the etiology. Thank you.
Thank you, Cheng. So let us look at the second acute periodontal infection, that is periodontal abscess. So what is periodontal abscess? Periodontal abscess means that it is a localized purulent infection, which is also known as pus infection, within the tissues adjacent to the periodontal pocket that may lead to the destruction of periodontal ligament and the alveolar bone. Looking at the clinical features, a person can be diagnosed with periodontal abscess with any combinations of the following signs and symptoms, such as a smooth and shiny swelling of the gingiva. As you can see in the picture, it's shiny, smooth and shiny. Pain within the area of swelling, and it's tended to touch. A purulent exudate, a pus accumulation, increased probing depth, sensitive to percussion and may be mobile. Rapid loss of periodontal attachment may occur. A periodontal abscess may be associated with the endodontic petosis. So what is endodontic petosis? It is a diseased condition of the pulp and tissues surrounding the roots of a tooth. Therapeutic goals. The therapeutic goals is to eliminate the acute signs and symptoms as soon as possible. The ultimate goal is to eliminate those signs and symptoms in the patient. Therefore, several treatments should be considered, such as establishing drainage by debriding the pocket and removing plaque, calculus, and other irritants. Debriding meaning removing the damaged tissue. Irrigation of the pocket, whereby a proper prophylaxis is done. Limited occlusal adjustment. Administration of antimicrobials or antibiotics, and managing the patient's comfort. For debridement, a surgical procedure may be required or considered. Comprehensive and effective periodontal evaluation should be followed to resolve the acute condition. That's all from me. I'll pass the presentation to Shui. Thank you.
Good morning, Doctor and my fellow friends. I'm Chong Shui. I'll be continuing with necrotizing periodontal disease. Basically, there are two types. Necrotizing ulcerative gingivitis is an acute infection of only the gingiva with sudden onset, whereas necrotizing ulcerative periodontitis refer to necrotizing ulcerative gingivitis that has further progressed. The infection involves the gingiva, periodontal ligament, and alveolar ligament, as well as leading to attachment and bone loss. Unlike other periodontal disease, it presents substantial necrosis of gingival tissues and destruction of periodontal ligament and alveolar bone. Moving on to clinical features of necrotizing ulcerative gingivitis, 3 signs and symptoms must be present to diagnose this condition. Firstly, the interdental papillae or gingival margin of the patient will be ulcerated with dead tissue. These ulcerations have a punch-out appearance and are covered by a yellowish-white or grayish pseudomembrane. Secondly, as what you can see from the image over here, the marginal gingiva of the patient appears bright red and he or she may suffer from severe gum pain. Thirdly, there will be profuse gum bleeding that requires little or no provocation. Other signs and symptoms may or may not present. For example, the mouth may have a metallic taste or mild odor due to tissue necrosis. Next, systemic reactions may also occur and is more pronounced in children. The patients may also have increased levels of personal stress, heavy smoking, and poor nutrition. Rarely, the patient may have low-grade fever, malaise, and lymphadenopathy. Both necrotizing ulcerative gingivitis and necrotizing ulcerative periodontitis may be associated with AIDS or other diseases where the immune system is compromised. However, similar features but having more intense pain with periodontal attachment and alveolar bone loss may be seen in necrotizing ulcerative periodontitis. That's all from me. My teammate will continue with the presentation.
Good morning, everyone. I'm Chang Yiyuan. Similar to gingival abscess and periodontal abscess, the main therapeutic goal for necrotizing periodontal disease is to eliminate the acute signs and symptoms rapidly. To achieve these goals, there are a few treatment considerations can be done. First, irrigation and debridement of the necrotic areas and tooth surface, which is also known as the removing of damaged tissue around the areas. Professional plaque and calculus removal can be done by scaling. Patient can be given oral hygiene instructions and introduce the use of mouthwash. In some cases, painkillers can be given to control the pain. Management of systemic manifestations including appropriate antibiotic therapy as necessary. Patients should also be given the counseling on proper nutrition, oral care, appropriate fluid intake, and asked to stop smoking on the spot. Lastly, a comprehensive periodontal evaluation should follow resolution of the acute condition. Thank you.
Good morning to Dr. Durga and all my friends. I'm Ang here who would like to talk about the following periodontal infection, which is the herpetic gingival stomatitis. Gingival stomatitis is a combination of gingivitis and stomatitis or an inflammation of the oral mucosa and gingiva. Herpetic gingival stomatitis is a condition that most often result from the initial gingival and oral mucosa infections with herpes simplex virus type 1, which is the HSV type 1. This infection is the most common cause of gingival stomatitis in children before the age of 5, and it will also occur in adults. Now let's take a look at the clinical features of this infection. These infections will be characterized by the combinations of the following signs and symptoms, which are generalized pain will be felt by the patients in their gingival and oral mucosa membrane. Next, we will see the inflammations on the patient's gingival and oral mucosa membrane. And thirdly, vesiculations and ulcerative lesions of the gingival and oral mucosa, which often is in yellow, perioral vesicular lesions can be seen in the patient. And the last one is lymphadenopathy, which is the enlargement of the lymph node can be happen in the patients. And the patient also will suffer from fever and malaise. The therapeutic goal of the herpetic gingival stomatitis is to relieve the pain and facilitate maintenance of nutrition, hydration, and oral hygiene. The most important component in the management of herpetic gingival stomatitis is hydration. Adequate hydration is often achieved with pain control. So analgesics such as oral acetaminophen and oral rinses are encouraged to make the patients to be more comfortable and promote the fluid intake. And now let's take a look at the treatment considerations for herpetic gingival stomatitis patient. The first one is debridement. Gentle debridement can relieve the pain by removing the infected and the dead tissue so that it can heal faster. Next, the patient counseling is one of the useful treatment for the patient as well. Dentist or the doctor should guide the patient in proper nutrition, proper oral health care and oral hygiene, appropriate fluid intake, and reassurance the condition is self-limiting. The next one is the antiviral medications can be used for the patient as well. And last, and one of the most important treatment consideration is to inform our patients that this disease is contagious at certain stages, so it will be very dangerous. That's all from me, and for the next periodontal disease will be presented by my groupmate Alice. Thank you.
A very good morning to all of you today. My name is Chang Chiwei, and now I'm going to continue with pericoronitis. Pericoronial abscess or pericoronitis is defined as an inflammation within the tissue which includes gingival and dental follicle which surrounds the crown portion of partially or fully erupted third molar. And the cause of pericoronitis is basically the formation of gum abscess by the entrapment of food debris under the gingival flap. And now I'm going to talk about clinical features of pericoronitis, which may include signs and symptoms of the following. Red and swollen lesions occurs in the area of inflammation that are painful to touch. Besides, the presence of purulent exudate or formation of pus fluid sac, which contains high concentration of leukocytes or mainly neutrophils, inflammatory molecules such as cytokines and lysozymes, and also dead cell matter is present in that area. And of course, trismus or lockjaw, which is the reduced opening of the jaw, lymphadenopathy, malaise, and fever may also experienced by patients when they are having pericoronitis. Now I'm going to talk about therapeutic goals of this disease, which includes elimination of acute signs and symptoms such as painful swollen red lesions in that inflammatory areas, including the cause of irritation such as food or plaque, which is a bacterial film that are trapped underneath a flap of gum around the tooth. That's all from me. Thank you.
Good morning to Dr. Widowati and Dr. Durga. I'm Abigail. Now I'll be explaining the treatment considerations of pericoronitis. The treatment considerations of pericoronitis are debridement and irrigation of the undersurface of pericoronal flap, the use of antimicrobials and tissue recontouring, the extraction of the involved or opposing tooth, and patients should be instructed in home care. Moving on to the management of pericoronitis. The treatment of pericoronitis is based on two situations. In recurrent infection, it is best to refer patients to oral surgeon specialists or extract the impacted tooth. In another situation is, if patients are having elevated temperature, gross swelling, cellulitis, and trismus or lockjaw, prescribe metronidazole to the patients and then proceed to whether to extract the impacted tooth or refer the patients to the oral surgeon specialist. That's all from me. Thank you.
Good morning, doctor. I'm Anbalvi. I'll be talking about combined periodontal endodontic lesions. Combined periodontal endodontic lesions are defined as localized circumscribed areas of infection originating in the periodontal or pulpal tissue. There are three ways it may arise from. The first one is from pulpal inflammatory disease. expressed itself through the periodontal ligament or the alveolar bone. The second one is from periodontal pocket communicating through accessory canals of the tooth as well as apical communication and secondarily infect the pulp. The third one is from sequela of a fractured tooth. This diagram represents the possible endoperio problems based on the classification given by Simon J.H. According to the classification, perioendo lesions can be classified into primary endodontic lesions, primary periodontic lesions, primary endodontic lesion with secondary periodontal involvement, primary periodontal lesion with secondary endodontic involvement, and lastly combined lesions. The first picture is showing a drainage of chronic apical lesion on a tooth with necrotic pulp coronally through the periodontal ligament into gingival sulcus. This can mimic the presence of periodontal abscess. The second picture is showing primary periodontal lesions which are caused by periodontal pathogens. Here, chronic periodontitis progresses apically along the root surface. Accumulation of plaque and calculus as well as deep pockets may be detected. In third picture, if primary endo lesion left untreated, it may become secondarily involved with periodontal breakdown. The tooth now require both endodontic and periodontal treatment. In primary periodontal lesion with secondary endodontic involvement, the apical progression of a periodontal pocket may continue until the apical tissues are involved. In this case, pulp may become necrotic when apical foramen or accessory canals are involved. Lastly, the combined lesion is formed when an endodontic lesion progressing coronally joins an infected periodontal pocket progressing apically. There are therapeutic goals for combined periodontal endodontic lesions, which is the elimination of signs, symptoms, as well as etiology as soon as possible. Signs and symptoms are including smooth, shiny swelling of gingiva, pain when touched, sensitivity of tooth when mobile, and lastly, rapid loss of periodontal attachment and periradicular tissues.
Good morning, everyone. My name is Caris. Now, I would like to continue with the treatment considerations of abscess. The goal of therapy is to eliminate the acute signs and symptoms as soon as possible. Usually, antibiotics alone will not cure an abscess. It must be opened and drained by debriding the pocket or by incising the abscess. Endodontic therapy such as root canal treatment helps to remove the infection, relieve the pressure, and usually helps to heal the abscess. Other treatment considerations include irrigation of the pocket to clean small spaces between teeth and gums, limited occlusal adjustment to relieve contacts, administration of antimicrobials such as penicillins and tetracyclines, and lastly, by the management of patient comfort. A surgical procedure for access for debridement may be considered. First, an endodontic consultation may be required. If the involved tooth has advanced attachment and bone loss, then extraction of the tooth would be indicated. A comprehensive periodontal and endodontic examination should follow resolution of the acute condition by management of multiple etiologic factors which may result in partial restoration of the clinical attachment that has been lost. In patients where the condition does not resolve, additional evaluation and therapy is required. That's all from our group 2.1. Thank you.